Larry, there's been so much advancement in medical devices, especially I'd say in the last 20 to 30 years. And all of these advancements at least have had the intention of really solving some issues. And obviously, on transmission control, we talk a lot about infection prevention related concerns, especially related to medical devices. And so, the thing is with technology, sometimes we fix a really big issue, but that doesn't necessarily mean that new technology doesn't come with its own challenges. And you and I were
And
talking
prices.
recently, and you had kind of found an example of this that you felt like this would be one that really should be highlighted.
Right. So in reviewing, as the audience knows, I spent a lot of time reviewing medical device reports in the FDA's database. And the FDA recently came out with this, I guess in 2019, actually, and again this year, with kind of moving healthcare facilities over from those duodenoscope models that have fixed end caps to those with disposable, single-use removable end caps. And the goal obviously was noble. It was, and the data are suggesting it does this switching from the fixed end cap of the duodenoscope to the new models with the removable end cap. It is reducing the contamination rate. It is facilitating cleaning, enhancing cleaning, if you will. But there's two adverse events. There's a price to be paid, and there are two adverse events associated with these new duodenoscope models that I think it's really important for clinicians to be aware of. And I haven't seen it discussed too much, at least not so much in published reports. So I think it'd be really our audience would be really excited to and to learn about some of these adverse events. So I'll get right into them. So the two are basically this. When we no longer have a fixed end cap at the distal end, we have a removable one, we want to make sure that we're correctly attaching that removable single-use end cap per the manufacturer's instructions. Because if we don't, two things can happen that I really want the audience to be aware of. The first one is, of course, detachment dislodgement. So we're doing a procedure in ERCP using the duodenoscope, and the end cap can fall off if it's not properly attached. Where does it fall off? Maybe in the stomach, the esophagus, maybe even in the entrance of the duodenum. And then this can extend the procedure, of course, because the physician now has to identify and locate where that lost end cap is and remove it. And there are even some reports, albeit very few, where that can be inhaled. That end cap can fall off in the patient's mouth or airway. And this obviously is associated with problems. The second particular adverse event that can occur if we have improper attachment of this disposable end cap is something called mucosal tearing or lacerations, where particularly during suctioning, when the physician is performing the procedure, there can be a gap in the distal end of the end cap around this removable end cap into which mucosal tissue can be drawn during suctioning. And unwittingly, the physician removes the duodenoscope and it can cause tearing. It can pull the mucosa along with the retrieved endoscope and result in rare cases of actual bleeding, which then has to be addressed. So these are two new adverse events associated with these new disposable end caps. The fixed end caps aren't ordinarily associated with them. So I just wanted to bring that to the audience's attention in our mission to improve patient safety.
Yeah, phenomenal, Larry. I mean, just keeping up with all the new technology. And again, as you said, rare circumstances obviously has been solving an issue in the industry, a pretty big one
The
leading up to the
contamination issue.
pandemic, probably one of the top conversations that we were having until then. And keeping up with technology is something that I know you spend a lot of time with. So thank you very much for that update today.
It's my pleasure. We'll be discussing more similar situations like this that I identify in the FDA's database when warranted.